So there's one quote saying that you only know what you know. You don't know what you don't know.
Yes.
Okay. Even my specialists, I talk to them and I realize that they are so focused on their career, but they miss out on different things in life, which could be fine to them. But personally, I would have I would prefer a more all-rounded approach to life.
Medical is like a black hole. Once you go in, difficult to come out. I think we spent a long period of time studying
Inside,
for it, medical school, housemanship, MOship,
Yeah,
and all
yeah.
specialization and all this stuff. I think it took a very long period of time of our life. This syndrome, it means that no matter how good you do, no matter how much you give, you still feel you are incompetent. Because
Yes.
there was always a comparison going in. You will always compare, this houseman is better than me, this doctor is
Yes,
better than
yes,
me.
yes.
So, and I'm not as competent as them.
Yes.
So you would always feel lesser. So to a
Yes.
point that, yes, it does cause a lot of them to quit.
Especially housemen, when they refer, right, they get yelled at through the phone or not by other doctors, specialists. I think this is part of it. You can't control how people want to react to a certain situation, but what you can do is take a deep breath, and your aim is to
Refer the case.
refer the case, and
Yeah.
you're not referring just for the sake of referring. You're referring because you can't handle it, your department can't handle it. You need some other expertise to come in and assist the patients.
Hai, selamat sejahtera. Saya Dr. Juwita dari Health Talks. Hari ini dengan kita Dr. Khang. So he's a houseman from
Hospital Sedang.
Hospital Sedang. Ini kita akan berbincang dengan dia beberapa things that housemans would like to know also. So Dr. Khang, can you please explain about yourself? Intro about yourself.
I'm Khang. I'm a doctor in Hospital Sedang. Currently a houseman. Yeah, I'm in my third posting.
Okay.
Yes.
Which department?
I'm in medical.
Okay, very
Yeah.
stressful.
Yes, very stressful. But I think I'm in control of it because it's not easy. But
Doable.
what we can do, we do.
Yes,
We try our
I
best.
think
you see.
after the first posting is usually gets a little easier. It's little bit doable.
I think a lot easier after the first posting. Yeah.
Yes,
A lot
I think the first
easier.
posting is very difficult.
Mm.
After the first posting, I think you get through it, and then I think you will just have the mindset that you can do this.
Okay. I think a lot of people get into the mindset that they can't make mistakes, but I think housemanship is the only time you can really make a lot of mistakes.
Yes.
Honestly, because there's no responsibility, not so much on us.
Yes.
And we always have our
Seniors.
MOs, seniors,
Yes.
and our specialists to refer to if we need help,
Yes. Like for myself, like the housemans that I coach, I usually tell them this, that when you are in housemanship, that 2 years, use it completely. Now you're going to learn, you're going to make mistakes, you're going to hone your skills, but end of the 2 years, make sure you are a very good doctor, because after you're done with the housemanship, you're going to be an MO. So when you are doing your MO, you are going to be the person that's going to look at the patient.
Yes.
So you do not afford to make a mistake.
Yes, I can't afford that. Yeah.
Yes, because we deal with lives. That's the
Yes,
problem.
yes.
So we have to be good. So these 2 years make mistakes, of course. Do make mistakes, but learn from it.
Yeah, but of course not intentionally, just for the sake of learning, Try to
Yes.
be as good as you can. Yeah.
Yeah, so it's just that you have to hone your skills, learn as much as you can. And it's okay. On the way, you do make mistakes, but I think it's fine.
Yes.
You just learn and move on.
Yes. Yes.
Okay, so Dr. Khang, you studied from which university? Yes.
I graduated from Penang Medical College.
Okay.
It's a branch university from University College Dublin, from Ireland.
Uh-huh.
So we get accredited with Irish cert.
Okay.
Yeah.
So, with Dr. Khang, something that interests me is before starting housemanship, you did do something else, right?
Yes. Actually, quite a lot.
Yes, you were in non-medical fields.
Yes.
So I would like to know more about non-medical fields. How does it feel to be in non-medical?
Okay.
field?
I think to answer this question, I have to give the audience a little bit of background information regarding what I did and all that. Right after I graduated from Penang Medical College, I stayed in Penang, and I joined a real estate agency. I started being a real estate agent, selling houses, obviously, and eventually I realized that that wasn't a long-term career path for me. So I went into different startups, started a couple of businesses, but eventually I realized that I should continue and complete my housemanship and get my full registration. At least if I were to venture into something else, then only I probably will find something that I can set foot in for the long run lah. Yeah.
So for now you are in third posting, right? So it's about a year in housemanship, right?
Just about 7 to 8 months lah. Yeah.
Okay. So when you what's the difference between medical and non-medical field?
What's the difference between medical and non-medical? I think the medical field is very, very good and very noble because obviously you're helping people. I'm talking about being doctors and in the hospital lah, right?
Okay.
You're helping people, so it's very noble, but it's very tiring. It's very draining, to be honest. But if you have a passion for helping people in that way, then it won't be as draining as other people who don't have passion might feel. You see. But on the other hand, it's a very niche. It's a very closed industry. So people in it would tend to be very close-minded and tend to be very less informed about what's happening outside. Whereas if you work in a non-medical field, it's so different. There's so many things going on in the business world, economics, say politics, even let's say sports, even trading. All these are so different, and what tends to happen is that medical-related people do not look beyond their own industry, and they just keep themselves within that little box of the so-called medical fraternity, which I think can be a mistake. But if you're so passionate into your own industry, then I think it's only a good thing that you're so focused in your career lah. Yeah. So the main difference is that medicine is mainly about saving lives and being a good healthcare worker to your patients, helping them out of misery lah, being sickness, right? Whereas in non-medical field, it's very difficult for me to say, but it's just so vast, so diverse, right? Yeah.
Okay, so if in non-medical, because in non-medical we don't see emergency cases, so
okay,
so I think maybe the stress, it's lesser.
The stress.
Can we say that?
No, I will never discount anyone's stress lah, cause I'm sure if you work as an accountant, say if you work as whatever, even a journalist, so every job has its own stress. But
yes.
if you
so
talk about
like for you, I'm asking for you.
Oh, for myself.
Yes, for yourself, because you were previously in a non-medical field. So compared to then and now, which one would you say?
To me personally, I prefer the stress that I got when I was outside the medical field.
Okay.
Because those kind of stress was more related to your own performance, more related to how you're performing, how the company is performing. Whereas the stress in the medical field, as a doctor, right, is more related to how patients do, and to be honest, in many cases, you can only do so much.
Yes, that's
you
true.
See? And no matter how much stress you put yourself through, no matter how well you do, no matter how ambitious, how helpful you are towards the patient, if the patient is meant to go, there's nothing much you can do, to be very honest. Yeah. Whereas the stress in the other departments other fields would be more towards personal development and hitting targets, goals, and kind of stuff lah.
Okay.
I think in the medical field, there's not so much of goals and stuff, unless you're talking about career pathway, getting your masters, getting a specialist training and all that, then it's different. But generally, I prefer the stress outside medicine lah. Yeah.
Okay. Yes, it's
Personally.
true. Yeah. Okay. I think it's very true that we cannot discount anyone's stress because everyone's stress is different.
Yeah.
So the way that we respond to it is totally different.
Yes.
So I think it really depends on how you take it. Some people get stressed and they are far more productive. So for me, if I'm stressed, I'm not productive. I'm really not productive. I would really want to wallow and I want to relax first. But some people, yes, of course, the stress does make them far more productive.
Yes.
They can really move forward.
Like stress can bend you or mold you. So it depends on how you want to see it lah. But to me, that also depends on the threshold. People are born differently. They have different backgrounds. So yeah.
So
you
the
should
pros.
understand.
So if we were going to talk about medical field, so the pros and the cons, what would you say?
Pros and the cons in a medical field.
Yes.
Okay, I'll start with the pros first. Like I said before, the medical profession is very, very noble for anyone who aspires to be a doctor. It's a very noble job. Please, if you like it, please pursue it. Do it wholeheartedly, and you'll be very fulfilled. From most of the friends that I see who are really, really into medicine, really good. And of course, you've talked about rewards in terms of the financial returns. And of course, when you are like well into your specialist years, you get quite decent amount of income, which is one of the main pros as well. But cons wise, there's quite a lot. When it comes to working hours, sacrifice for your personal life and also your time with the family, you might not have as much time for your own other interests as well, And the work cultures can sometimes be not the best. I'm sure Dr. Jivita, you can
Yes.
testify to this.
Yes. Previously, yes, it was very true for me. But now I think since I am no longer with KKM, I think I have better work-life balance.
I think that's upon your own initiative, because then you have to find a way if you
Yes, I because I prefer in that way. I would like to, because I have so many interests. I want to do so many things, so I think it's good for me. But it really depends on the person. What is your interest and
your
what
passion.
What's your passion?
But for me, I'm still relatively young, I'd say, in this journey.
Yes.
Obviously, I want to get things done as early as I can, but sometimes things take time. Will take time, especially like us in the medical field, right? It's not easy, but you should persevere. Whatever you do, just give it a good go until the end, like what you're doing now with your own your practice, right?
Yes. I am still practicing, of course, and I also do teach housemen. So this is what I usually tell them: if you are really, really interested, this is your passion, go for it.
Okay.
Yes, it is kind of very difficult and stuff, but I think long run it is very fruitful. You feel very fulfilled.
Yes.
So end of the day, it really depends on what you really want.
Yes, but one big con is that people tend to be very limited when it comes to what they know, what they don't know. So there's one quote saying that you only know what you know. You don't know what you don't know.
Yes.
Okay. If you don't know what's happening outside, you will never know what you don't know. You see. So I think that's what I encourage a lot of medical related people to, even to my MOs. Sometimes I talk to them, even my specialists. I talk to them and I realize that they are so focus on their career, but they miss out on different things in life, which could be fine to them. But personally, I would have I would prefer a more all-rounded approach to life. But that's just me,
Yes,
Different people have
I'll
different
tell you one thing.
choices,
Medical is like a black hole. Once you go in, difficult to come out.
Difficult to come out.
Because I think we spent a long period of time studying
Inside,
for it, medical school, housemanship, MOship, and all specialization and all this stuff. I think it took a very long period of time of our life. So now you are just like, I'm already in this, and you mostly you're passionate about it. So you just want to do more.
Yes.
Okay, so as for you, as for houseman, what struggles do you think you have?
Oh, struggles. Okay.
Yes, do tell.
You have a question? No? Okay.
Do tell.
Struggles number one would be you would doubt yourself most of the time.
Yes.
Because seeing your colleagues, even your seniors, some of your colleagues who are around the same level as you, who are way more competent than you, they know more things, they did better in university, so they obviously have more theoretical knowledge and stuff. So sometimes these kind of things could break you. And the worst thing is if you wake up going to work feeling shitty.
Yes.
If I can say that,
Yes.
So that's one of the biggest struggles I used to face in housemanship. But you should also realize that there's always people to back you up, as long as you are willing to seek help.
Yes.
Right.
You're willing to learn. So the thing that you said, it's called imposter syndrome.
Yes.
Okay, so
in short, yes.
the imposter syndrome, it means that no matter how good you do, no matter how much you give, you still feel you are incompetent. Because there is always a comparison going in. You will always compare, this houseman is better than me, this doctor is better than me.
Yes.
So, and I'm not as competent as them.
Yes.
So you would always feel lesser. So to a point that, yes, it does cause a lot of them to quit. I have housemen who quit because they do feel that. But I think it's all depends on you, how much you are willing to learn, how much you are willing to go for it.
Yes.
So if you are willing to go for it, then I think it happens in the first poster lah. First poster, the imposter syndrome is very strong.
Yes, but one thing is that people should realize, you know, for you to get good in something, even like if you're doing this podcast, if you want to be really really good in the long run, you have to go through different difficulties, right?
Yes.
The initial struggles, learning how to set up, how to all this, right? So I think it's inevitable. Like, you know, you see it as a part of the process lah. Don't see it as the end. Like, you know, it's gonna be like this for the rest of my life. No lah. It's probably just today lah. You know, till tomorrow is fine lah. You know.
Yeah, it always gets better. It always
Yeah.
gets better. So
And
maybe the first 4 months of housemanship, the first posters.
First post. I think no. For me personally, the first 2 months were tough. After that, it
Better.
got so much better because you get used to the system, you get used to the people, you know, and people get to know you as well. You know,
Yes.
they treat you better. So I think, and most importantly, you have to adjust yourself towards, you know, towards the job itself. You know, accept yourself, accept your own flaws, your own limitations, and then you know, you feel better lah. Ask for help if you need to. Yeah.
Yeah, I think it's like there's always MO specialists. So
Yes.
and your senior housemates, you can always refer them.
So-
you can always ask them.
Yeah, you can ask them, but that also leads to a second struggle that I see in a lot of housemen lah. They always have this fear of getting scolded.
Yes, that
So
is
to the audience who, I mean, I'm just a houseman still. I mean, Dr. Jivita used to be an MO. She's like way more
Yes.
advanced than me, but I think a lot of people, especially housemen, when they refer, right, they get yelled at through the phone or not by other doctors, specialists. I think this is part of it. You can't control how people want to react to a certain situation, but all you can do is, you know, take a deep breath, and you know your aim is to
Refer the
you know,
case.
refer the case, you know. And
Yeah.
you're not referring just for the sake of referring. You're referring because you know you can't handle it, your department can't handle it, you need some other expertise to come in and assist the patient. So that's the ultimate goal lah. If you think about, is the MO, is the specialist going to scold me, you know, is the patient going to react to me well, is my own MO going to tell me to do you know, difficult things. Those are things that you cannot control. So I would advise you to just
think about it.
chill lah.
Okay, so lastly, so as a houseman, what would you give advice to other housemen?
As a houseman, okay, try to take
Chill.
your job seriously, but not so seriously.
Oh, that is a very good advice
Ah.
actually. That's a very good
Yeah.
advice. Okay.
Because, you know, I'm not asking you to not do your job properly, but try your best. I'm sure the work that you do won't be that bad, but know that you can always improve, and know that you're always good. And
Yeah.
that's how you graduated from medical school lah, right?
Yes.
And then when necessary, please take your leaves, your ALs, whatever, if necessary, you know. If you need a break, I don't like it when my colleagues take MCs, but, you know, if necessary, please do. You know, there's always people to cover you
Okay.
adequately, but don't
Overdo it.
overdo it. Yeah. Don't abuse the
Okay.
power lah. Yeah.
Okay.
And be someone who you would like to work with when you deal with other people lah, you know. Don't be toxic to other people. You know, if
Yes.
people ask for help, if you're free, just go for help. Just help.
Yeah, I think in 2 years you should learn that part. You know, you really want to be a person that someone wants to work with. You know, someone wants to be your team, and you want to
Yes.
be someone's team also. So I think it's the teamwork is very important.
Yes.
So learning that in housemanship is very important, I feel.
I think a lot of people, as they progress from junior houseman to senior houseman, or even if they progress to MO-ship, they bring this attitude whereby, you know, I'm getting more senior, the juniors suck, you kind of suck, you kind of, you know, you're so bad, you know, why are you so slow, all this. But remember, you were once there also.
Yes.
I was once there. I was once very slow. I was once stupid, right? So think of it that way, then I think the world can be a better place
Oh,
if
yeah.
we decide to make it a better place, you see.
That's very good.
Yeah.
I think with that we will end this.
Thank you.
Okay, thank
for
you so
the opportunity. Yeah,
much.
thank you.